What's up, hoopers? Do you have jumper's knee or pain in your patellar tendon when jumping, running, or playing basketball? I'm going to go over why you have jumper's knee, and we're going to talk about the different variations why people get it in relation to their training. So my name is Dr. Marco Lopez, Doctor of Physical Therapy and co-founder of the Basketball Doctors. And for today, like I mentioned, we're going to go over why you truly have jumper's knee. So when we talk about jumper's knee, we have a video below that explains all about jumper's knee, what exactly it is. But it's usually a tendon overload. So you have your kneecap, then you have your patellar tendon. What happens when you're playing basketball or soccer or football? You start overloading that quad, overloading that tendon, and eventually that tendon, it just gets too much overloaded and you start having some pain there. And it's not tendinitis like we talk about. There's another video if you check in the description below of jumper's knee versus patellar tendinitis. Tendinitis, it's an acute. It's usually a weekend. Let's say you played 5 games, you just overloaded that tendon, you rest it for a day, you'll be fine. Jumper's knee, what we hear a lot of people is, hey, I rested for a week, I went back, and then when I went back, it flared up again. And that's what we're going to be talking about with training frequency and volume, why that doesn't work. So when it comes to jumper's knee, like I mentioned, imagine a bucket, and that is your jumper's knee, that's your tendon per se. So a bucket, just imagine a bucket where we're going to put water. The water is the training volume and frequency. So if you put too much water over a long period of time and the bucket stays the same size, the water will overflow the bucket, and that's when you start having that tendinopathy or that pain in the patellar tendon. So when it comes to the training and volume and frequency, we want to make sure we are slowly, progressively overloading little by little each week, and that's going to decrease our risk to get jumper's knee. And I'm going to give you an example where a lot of people get flared up and they had jumper's knee issues. So let's say you sprained your ankle, and this is one of the most common ones that we see. We sprain our ankle, we get off of it for a week or two, then we go back to our normal basketball schedule. Let's say if you're in high school, you're playing twice a week, but you're having practice 5 or 6 days a week. So you sprained your ankle, you're out for 2 weeks, and usually what people do when they return, instead of gradually returning, taking your time, slowly ramping up, they just go back to their normal routine, their normal volume pre-injury, but they're still not ready. Their ankle is ready, but their body wasn't ready to handle those demands of that practice. So you won't feel discomfort the first week. It's usually the second or third week where then you start seeing some changes, like, oh man, my knee tendon's hurting, the bottom of my kneecap's hurting, and that's because you overloaded, you went back too fast too soon. So we're going to talk about different guidelines that I like to use after coming back after an injury, and this also applies to being sick. So a lot of the times, especially when there was COVID, people that had COVID or that had the flu that were out for a week, and then they just go back to their normal schedule. So if you're training hard and then you stop completely and don't do anything and then go back to your training hard schedule, that's going to flare up the tendon over time, and that's going to lead to those issues of jumper's knee. So one of the biggest rule of thumbs is, as you're getting back into these activities, let's say you're going back to basketball 5 days a week, your normal schedule was 5 days a week. If you sprained your ankle or you were sick and you took 2 weeks off, or just normal time off, you went on vacation or anything, you want to slowly go back into it. So normally I give that rule of thumb of 10%. So the first week, if you're doing 5 days a week, I would start off with 3 days a week, Monday, Wednesday, Friday, give you some rest, and then each week you add in another day or 10% volume. So normally what we tell people is log in the minutes that you did that week. Let's say you normally go 6 hours of basketball. And the first week when you ramp up, try to go 2 or 3 hours. Then the next week you add in 30 minutes or an hour, see how you feel. But we're slowly, progressively overloading, as opposed to just jumping straight back into those 6 hours or 5 days a week of basketball. We're slowly ramping it up. That gives us enough time for that bucket that we were talking about to be in that good position where we're adding in water little by little, and that bucket then gets to accustomed to that size of water that we have. Unless if we just go back into basketball right away, we have that bucket and we just turn on the faucet and that water just keeps going into the bucket and it overflows. But right now we are controlling the amount of water into that bucket by turning on and off the faucet, and that's where we have that load management, or just increasing little by little each week. Another thing that I talk to people about jumper's knee, and this is one of the most common ones, is when you have jumper's knee, a lot of the times people are doing a lot of plyometric exercises. So a lot of people start a new plyometric program and then 4 or 5 weeks into it, they're like, hey, my tendon hurts. And that's because they're overloading that tendon. Maybe their plyometric program didn't have a ramp up time. So normally I tell people when it comes to plyometrics or jumping exercises when you're doing, you want to start off around 40 to 60 contacts at first, okay? Don't start going into 100 contacts. And 100 contacts, when we talk about, is you landing. So let's say you do a single leg jump and then you land, that's 1 contact. So we want to have 40 to 60 max the first time you're going back into plyometrics in your first session contact. Then you'll do that for a whole week. If you do plyometrics twice or 3 times a week, do 40 to 60 every session. Then the next week, you want to increase 10% max. So if you, let's say between that 40 to 60, you did 50. So the next week, you're not going to jump straight into 60, you're going to go to 55, go 10%. And the following week, 60. That's going to give us the safest possibility of you not getting jumper's knee, you not flaring up your tendon, decreasing your risk for injury, and we're progressively overloading. And during that time, if something flares up, we're able to catch it right away, as opposed to if you go from 40 to 60 straight to 100. So you want to limit those jumps and then increase 10% each week as you're progressively overloading it. And that gives us time to get your legs stronger and you kind of feel your body seeing how it responds to that increase in load, and as opposed to you just having that crazy spike in load. So if you look at a graph, so here's the time, this is the amount of load. We want to just have a gradual increase of how much more load you're putting on your knees, meaning you're running more, jumping more. We don't want a huge spike. When we have those huge spikes, we increase our risk for injury, especially when we have those huge spikes for a long period of time, then we drop down. And that's when we play into that factor where people say like, hey, I have jumper's knee, I took a whole week off, I came back and then flared up again. Yeah, it felt good because you weren't on it for that week, but when you went back in, you went back to the original routine as opposed to going 50%, then 75, then 100%. So you give yourself a 2 to 4 week ramp up usually. And that's kind of what we tell people with this jumper's knee. It's a lot of the reason why people have these tendon issues is because of these increase in loads, increased spikes, and not progressively overloading as opposed to the strengthening. The strengthening plays a huge role, but you could get stronger glutes, stronger quads, improved flexibility, improved movement. But if you had these spikes and increase in load, it's just gonna flare up that tendon regardless how strong you are. That's why you wanna slowly, progressively overload that tendon over time. So remember, the recap, here is your graph. You want a line to be gradually increasing. So every week you're increasing loads little by little, as opposed to a line where it's like huge little spikes here and there, spikes and drops. So meaning like you go hard 2 days and you drop for 4 days and you go hard for 2 days. So you want that consistent gradual increase in load, and that's gonna help protect your tendons. So hopefully you guys like this video. It's just to recap, when it comes to jumper's knee, one thing that gets often underlooked is that loading, training frequency and volume on your tendons. And like I tell people, you can have the best rehab, but if you're not slowly, progressively loading your tendon, that's going to lead us into some problems. So make sure you're not going up by more than 10%. And if you're injured or you're sick and you're going back to sport, slowly work your way back to sport as opposed to just going from the bed straight to the court right away. So take your time, progressively, little by little each week. Don't increase by more than 10%. That's the normally rule of thumb. So my name is Dr. Marco Lopez. Hopefully you guys like this video. Hit the like, share, subscribe button and share this with friends and family.